Hi everyone, this is Dr. Stefan. In this video, I'd like to discuss a little bit about the issues that sometimes patients have after recovering from COVID. And one of them is having a cough with a sticky phlegm that doesn't seem to go away. It's a fairly common occurrence, and I'd like to just give you a couple of ideas on what this might be and what you may be able to do to help things along. Now, obviously, I'm not your doctor. So first of all, I'd like to say this right off the bat. If you're having issues with your health, please consult a medic, a doctor, wherever you are in the world, someone who can actually provide you a consultation, see you perhaps in person, or at least during a phone consultation, someone who can provide you advice personalized to your situation. That's really important. You don't want to necessarily be looking for advice on the internet or to listen to my videos and then consider that that's going to be great for you in your case, because it may not apply to you. Now, that being said, this question has come up a lot. Basically, what to do if there's still an ongoing cough, maybe 3 to 4 months after recovering from COVID, and there's a little bit of a phlegm that doesn't seem to go away. There are a couple of reasons why this may happen, but probably the most likely is that there's still some lingering inflammation in your airways. Many patients have reported that. Normally, we do expect that with chest infections of any kind, of any viral illnesses that affect the chest, we may expect that in maybe 6 to 8 weeks, we would be back to normal. And normally what happens is there is a residual cough after a chest infection that lasts for a few weeks. It tends to improve slowly, but it gets better. Now, obviously, if this symptom, the cough with the sticky phlegm, persists for months after recovery from the acute COVID infection, there may be something going on. So that inflammation may be resolving slower than usual. And in this case, it's important to think whether there is still anything that's driving the inflammation. It may very well be the COVID, but in many instances, I've found that there are some other issues at play. One thing I would mention is are you well hydrated? This is a question you might want to ask, because many patients really can't seem to bring up the phlegm because they are quite dehydrated. Myself, I do the same sometimes. I have a tough day at work and I even forget to drink a glass of water or something during the day. I just drink some water when I get home late in the evening. That's not a good thing to do. And I advocate keeping well hydrated. You don't have to drink liters of water. That's probably going too far. But just keeping a normal level of hydration, having a cup of water every few hours is probably great. And that may help loosen the secretions in your airways and help you cough them up easier. Because also, you need to remember that when you start to cough, when you have a bout of coughing, you can't bring something up. You cough, and you irritate your airways a little bit more. Your throat will get irritated if you're really coughing your lungs out, basically trying to get some phlegm up. If you can make them a little bit loose, these secretions in your airways, it might go a long way towards improving the cough and not maintaining that inflammation in the airways. The other thing would be to consider whether you are still exposed to any airway irritants. And here I would probably mention, if you are a smoker, if you're actively smoking, I would say maybe it's a good time to think about quitting, because obviously that smoke that you're inhaling and that's irritating your airways is probably not a good thing. And your body is actually probably sending you a message that it's time to quit. It's time to stop this because, the airways aren't feeling great. It's not only smoking. If you're working in an environment where you are inhaling a lot of dusts, a lot of fumes, you may consider wearing appropriate personal protective equipment. So in the form of well-sealed masks that protect you from inhaling different particles from the environment. So that's something that you may want to consider. You may want to consider ventilating the space where you work quite well, if you're, for example, working in an environment which is very dusty. So these things can go a long way towards preventing irritation in the airways. The other thing would be if you are, for example, suffering with acid reflux, or you're having some secretions from your nose that seems to be streaming down to the back of your throat and making you cough. So for both of these things, you might want to consider whether you might benefit from sleeping a little bit propped up for a couple of months until everything resolves, so that those secretions and that acid doesn't pool around here, around the throat area. That would eventually irritate your throat and make you cough. So going about it this way might actually help. And obviously for acid reflux, which can come up from your stomach, gastroesophageal reflux, you may want to consider some dietary adjustments. So if you're eating big meals before you're going to bed, that's going to be quite bad for acid reflux. If you are, for example, eating a lot of acidy food in the evening, maybe you might want to move these earlier in the day so you're not getting all that acid when you go to sleep and when you lie flat and the acid comes up. Or you may want to, consider losing a little bit of weight if that's an issue for you, because obviously that weight on your stomach will worsen the acid reflux. But these are things that are not easy. These are lifestyle changes that may actually improve your recovery process. And obviously, to keep active after you've recovered from COVID, that's really a must. You need to be out and about. You need to be taking steps towards recovery. Even though you've had a severe form of COVID potentially, or you were quite ill at the time, you need to start resuming your daily activities, going for a walk, taking deep breaths in, going out into fresh air. This might help actually move these secretions around and minimize the cough that you're having. Obviously, if none of these help and the phlegm is still sticky and you can't really loosen it and bring it up, there are some medications that can be tried. These I would suggest you discuss with your doctor before. So things like acetylcysteine or bromhexine. These are medications that loosen the phlegm a little bit, make it a little bit easier to cough up. But I would say discuss with your doctor first to make sure they're indicated in your case. The other thing to try may be aerosols, so saline fluid aerosols. These can help some people loosen up secretions and help them clear their lungs. But again, with aerosols and inhalers, nebulizers, things like that, it's a good idea to talk to your doctor first to make sure they're right for you, because some people actually have more irritation with nebulizers, even if it's normal saline that they're putting in that machine and making the aerosol to inhale. So it's important to consider your case. And if you are trying one of these nebulizer devices, if you are starting to cough more and you don't feel well, I would suggest it's not a good idea to continue and to discuss with your doctor in that case. But to conclude, I think I'd like to just suggest that it's a good idea to be patient, because with COVID, we don't really know the long-term implications that much. And it seems that the inflammation in the airways does take longer to clear. And it may just be that it takes longer in your case. And it's not something that anyone can predict, really. It may be that you'll feel better soon after, but if it takes months and months and months, it's a good idea to discuss with your doctor whether there's been any complication that has happened, or if the COVID infection triggered any new condition that wasn't present before. But I would say if you've been patient for 3 months, 4 months, 5 months, and things aren't improving, they don't show any signs of going the right way, I would say it's a good idea to consult your doctor. These are just a couple of things I thought about which might be helpful, some pieces of advice. And if you are in doubt, if you are still struggling with problems after COVID-19, I would suggest seeing your doctor to see what might be going on in your case. Hope this was helpful, and I'll see you in future videos. All the best and good health.